In my practice, patients come to me all the time with questions about heart health, what their test results really mean, whether their numbers are something to worry about or not, and how it all connects back to the way they eat, move, and live. What strikes me is just how much confusion and misinformation are still out there around cardiovascular health, despite it being the number one cause of death in both women and men worldwide. The good news is that there's so much that we can do. If you've been putting off getting your heart health parameters checked since everything feels fine, or maybe even due to fear of what you could find, I think you're going to find this episode today with Angela Hartley really eye-opening. Angela is a nurse, cardiac rehab specialist, personal trainer, and nutritional therapist based in Surrey, UK. Today, I get to pick her brain on all things heart health, from cholesterol and blood pressure to the myths that have been around impacting your nutrition choices. I hope you stick around because we are about to learn a ton about the organ at the center of it all. Before we get going, I want to take a moment to talk about something I am deeply passionate about and a theme in this episode: preventive care. When it comes to your health, preventive care is simply the practice of being proactive before something goes wrong. This could come in the form of checkups, testing, and of course, nutrition. The heart is one of those organs that can be quietly struggling long before you feel a single symptom. I hope this conversation is an invitation to start paying a little bit closer attention. So use this moment as a genuine check-in on where you are, where you want to be with your health, and the small preventive steps that can help get you to your goals. All right, I'm so excited to jump in. First, let's lay the foundation of heart health. Then it's all about testing and a few common myths I really need to bust. Angela, welcome. You've spent your career helping people improve their cardiovascular health, so I'm really excited to have you here. Can you share an overview of what we're looking at when we chat about heart health, the risk factors at play, all the way to the cardiac events that they can lead to?
One of the key things is knowing your numbers, things like blood pressure, whether you're at risk of diabetes, cholesterol. And then we can think about other factors like, are you exercising? Are you a healthy weight? How are your stress levels? The heart comprises of lots of different areas like, how is your lung health? How's your physical health? How's your mental health? And how does that all play a role in your heart health? And then moving on to what if it all goes a little bit wrong? Well, we can get disease when things contribute towards things like high blood pressure over many years. We can end up with a higher risk of heart attack, stroke, and heart failure. And they're really key ones that we ideally want to avoid in the future.
A lot of these things like blood pressure, for example, or even cholesterol, they're quote unquote silent. So people don't really know that they have it. I think sometimes folks don't take them very seriously. They fear other diseases more, but this is a big deal. What should listeners be getting tested for in relation to heart health?
The easiest and cheapest one is your blood pressure. The next one is in your annual blood tests, ideally annually, particularly over the age of 40. The biggest one will be your diabetes, so that HbA1c, because if that's creeping up and you're seeing those slow increase in that number, there is signs there that something's not quite right. So you can action that quite easily and quite quickly. The other ones is your cholesterol, so particularly your LDL. There are some more in-depth cholesterol testings that you can do. At the moment, the treatment is the same. So we can test things like lipoprotein A, ApoB. If they are elevated, it can indicate a little bit higher risk of heart disease. So you can then take action by treating the cholesterol, changing your diet, making sure you have checkups regularly, medication if it's appropriate. So they're the main easy ones, I would say, just to say, am I okay?
You know what I love about what you just explained is you pulled A1C, hemoglobin A1C. It's a blood sugar marker into the cardiac conversation. I would love to hear a little bit more about how A1C, which tells us your risk for prediabetes and diabetes, how does that play into cardiovascular health?
So we know that having diabetes in itself is an independent risk factor, and it's one of the highest risks of developing cardiovascular disease. The reason for that, particularly if it's poorly controlled, is the damage that high glucose can do to your blood vessel wall. We then have the issue of how do we patch up that damage? That's when the cholesterol comes into play. So it's a bit of it's causing the fire there, and then the other factors come into it to cause that atherosclerosis. So it's a little bit chicken and egg of making sure we're treating the cause before we get to the point where we need to treat the damage that's being done.
It's such a great point. A lot of folks don't realize how important it is for blood sugar management in the cardiac conversation.
Yeah, absolutely. And I think sometimes we medicate quite quickly once we hit a certain number, but we're not catching people before that point where we can see a real upwards trend. And some of that could be stress related, could be hormone related, it could be just age. Lots of factors go into it. So it's tricky to pinpoint one thing. But as you say, it's so key and so easy to test that we should be doing that at least regularly.
I agree. I advocate for this a lot. You mentioned folks maybe 40 and beyond. Is there any time that you recommend people getting tested in their 20s or 30s for this kind of regular labs?
I don't want people to be super health anxious. So as long as things are normal, there isn't necessarily a need to do it all the time. It's important to know that your numbers are good, carry on with your healthy behaviors, keep doing all the right things. Maybe if there are those subtle signs of, I haven't been exercising lately, maybe I'm more stressed at work, maybe my diet's not been as good, it would be a good time to test maybe every few years in that scenario, and then have the reassurance, everything's good, carry on, or actually everything's okay, but you still need to make sure your diet's good.
It's a great point. And you mentioned something that I really believe in, which is trends. So sometimes people bring to me a one-off really high triglyceride or really high A1C or what have you. And I say, how long has it been this way? Do you have any legacy labs? So I can start to understand if it's trending quickly up or slowly, if this might be a one-off and we need to retest. I just think that trends for these kind of slow-moving labs are so powerful.
Yeah, absolutely. And it can take years for us to get to that diabetic level, and we can catch it much earlier. And I think sometimes we're often borderline, but because it's within that green range, which is quite a long range for many of our markers, it's not flagging it as quickly as it could. And even the pre-diabetic range, it is quite high. So we should be hitting action before that point.
Yeah. I'm advocating for people to be getting these labs drawn. I do have people in their 30s even where these are trending high. So I love testing, but I agree with you. We shouldn't be over testing, or sometimes people are like, can I get my cholesterol drawn every month? And I'm like, oh, that's too much. So you need to work with your team to figure out your risk factors and what's right for you without over testing or under testing.
Yeah, absolutely. And if you've got like a really strong family history, you might want to do it much sooner. If you're on the contraceptive pill, you want to take your blood pressure even more regularly. So there are nuances to testing more often for sure.
Is there any difference in testing, in your opinion, about females, males, or is it all the same?
So because females present often quite differently, they may not have the same tests provided or suggested by their medical team. So that's an interesting one of, how do we know if we're not being tested? But I think it's the same tests. It's just recognizing that perhaps if you don't present as obvious, if you don't have any heart symptoms, it's still important to have those same tests that the classic man with chest pain may experience. So still testing the blood pressure regularly. And interestingly, things like gestational diabetes, that may be a sign if you had diabetes during pregnancy, to test that more often as a woman, or as known in high blood pressure in pregnancy. So if someone's had preeclampsia, testing that blood pressure at least annually.
You mentioned something so important, that females and males present differently sometimes for cardiac events. Can you walk me through that? What should people know about this?
There is the classic for both sexes of the classic, you see in the movies, the heart attack symptoms. So some people do present with those, which is the chest pain, they feel sweaty and clammy and a bit grey. They may feel breathless and puffed. They may feel a bit sick. But for females in particular, sometimes they don't have any of those. They may just feel a little bit off. They may have back pain. They may just be really fatigued, which isn't like them. Sometimes there's that sixth sense as well of things aren't right. I'm never ill. Something's going on. So it's really important that whoever you are, you get checked out quickly if you've got any of those emergency type symptoms. If they're those little niggles where you think, oh, I'll go to the doctor next week, I'm not that bad. I think it's always important to think, well, actually, could this be something serious? Why not go and get it ruled out just in case?
It's so important. And I learned recently that even for things like CPR, I heard that females get CPR at less rates than males. And so I think there is this gender discrepancy that is really scary out there regarding cardiovascular health.
And apparently that is because people are worried about exposing the breasts, or they're not sure whether to take a bra off, so they get a bit awkward about it. But if someone is collapsed and not breathing, the only life-saving treatment that will help until an ambulance arrives is CPR. So even if you do it on top of the clothes, you've got to do something immediately. So it is a shame that more women aren't diagnosed quick enough and they aren't treated quick enough.
I'm really glad you brought that up. Well, like so much in nutrition, heart health has suffered some confusion and misinformation over the years. I get many questions about this. So I wanted to hear from you, from the cardiac nurse perspective. I'm going to rapid fire 3 topics if you're game for that.
Yeah, go for it.
All right. Tell me what you say when folks ask about eggs and if they're safe to eat.
Safe to eat. Some people were scared of eating foods that have cholesterol in them, which eggs do. But we now know that dietary cholesterol doesn't necessarily increase your blood cholesterol. So safe.
Love it. How about sodium and salt in the diet?
Yeah, important to have some sodium in the diet. We are eating as a whole, as a society, too much sodium in processed foods. So cutting down on those processed foods generally brings you into a healthy intake of sodium daily. So okay in moderation, cut out the excessive salt in your processed foods.
Love it. A final one. I love that you're clearing these up. Saturated fat.
Yeah, it's a controversial one, which has been up and down. A little bit is okay. We have strict guidelines on the recommended intake. I think we tend to go to extremes, and that's not good for people. So we don't want to have too much saturated fat. We don't want to be so scared that we never drink milk again and we never have a little bit of cheese on our lovely Mediterranean food. So a little bit is okay. Look at the sources, making sure that there are nutrients behind it as well, not too much.
The research on eggs and other foods with cholesterol in them, like shrimp, comes to mind, has really shifted. Those are totally okay now. And different countries have different guidelines for sodium and saturated fat, but I think they're quite similar. And I do see sometimes people saying, well, sodium's bad. I have high blood pressure. I need to eat none. But to your point, you need some to live. And so there's this line of individualization. And what does each person need for their own health? And what does restriction look like within reason?
Yeah, absolutely. And also enjoying life, right? Because if you are so restricted that you are then unhappy, you're not being able to go out and be social, that also has an impact as well.
Angela, one thing I think folks don't understand clearly enough is that different dietary interventions affect different labs. How do you approach that from a nurse perspective?
A lot of the time it is understanding more about what foods impact your LDL cholesterol first, because that is the marker that most of them know about. Their doctors probably told them about and told them that we need to treat that and get that number down as low as we can. So that will be through reducing your saturated fat intake and looking at things like, what is your current intake like? Do we need to focus on that? And getting rid of a lot of processed foods will often automatically do that because it will be in a lot of the processed foods. It will be added to it as a nice way of making it palatable, for example. The other one that you mentioned was the triglycerides, and it can be improved by things like reducing your sugar intake, reducing alcohol, reducing saturated fat again.
I actually talk about triglycerides a lot. It is a type of fat in the blood that is affected by a higher intake of added sugar and alcohol. So if you have a triglyceride problem, that's how I'm going to educate. If you have an LDL bad cholesterol issue, you're right, saturated fat and fiber. A lot of my clients really focus on individual foods. Like, okay, I can't have any cheese anymore, but I tell people it's a percentage of your total calories. So we actually need to look at your saturated fat in all foods throughout the day rather than focusing in on individual one-offs. Is that how you approach it?
Yeah, it's the same. It's tricky to know exactly how to teach people because it's so overwhelming of knowing what's in every single food. It's trying to unpick it all and making sure they're not overwhelmed as well.
I think sometimes when you feel like you need to flip your whole world upside down and change everything you eat, but you can make some small changes. I'll often have people go from whole milk to 2%. That slashes saturated fat intake, which can directly influence your LDL. It can be as simple as that. And looping back to the confusing point that eating cholesterol from eggs and shrimp doesn't equal cholesterol in your body. I think that's a little confusing for folks. So we used to restrict eggs because eggs have a lot of cholesterol, thinking that would cause high cholesterol, but that's just not the point. It actually is more of a saturated fat problem.
Saturated fat and also looking after your liver. So the liver will produce a lot of cholesterol. So it will taper down if you're eating a little bit more, say shrimp or eggs. So the body is so clever, isn't it, of balancing things out and looking after your liver health by not having too much alcohol, not having too much sugar, which can really impact your liver as well.
I really like that you brought up liver health because I think that one of the number one questions I get is what kind of liver cleanse should I do or what kind of herbs should I take to cleanse the liver? But honestly, not drinking alcohol and not having too much added sugar are probably the most powerful things you could do to support your liver. Before the conversation keeps rolling, this episode is brought to you by Orgain. If you're someone who genuinely struggles to get enough protein in without it feeling like a chore, Orgain's 30-gram protein shake could be a total game changer for you. With 30 grams of protein, 1 gram of sugar, and ultra-filtered premium protein, it tastes great and can be the perfect choice after a workout, between meetings, or on one of those days where you just can't get to your kitchen. Vanilla bean is my go-to, but they also have cafe latte, chocolate fudge, and fruity cereal, so I'm sure you'll find something you love. Head to Orgain.com to try it for yourself. I'm so interested in what Angela and I have covered so far. It's great to get her perspective on the risk factors to watch for. With that said, I want to zero in on one she mentioned that I believe gets left out of the conversation more than it should. And that, my friends, is stress. Let's jump to the myth-busting minute. Yale Medicine recently shared an article featuring some of its leading cardiologists, and they pointed out a couple of notable ways that stress can contribute to heart disease. First, stress can lead to high levels of inflammation in the body, which can contribute to an increase in plaque buildup in your arteries over time. Additionally, stress can increase catecholamines. That's stress hormones and neurotransmitters that heighten your alertness in stressful situations. The downside there is that when you're in a chronic state of stress, it can raise blood pressure. The cardiologist also noted something similar happens with chronically high cortisol. That's another stress hormone, which can increase blood pressure, blood sugar, cholesterol, and triglycerides. The bottom line here is that stress can and will ultimately impact your heart, but that doesn't mean there's nothing you can do about it. Maybe you turn to fitness, meditation, or a friend who supports you and listens. Or if you need expert support, that's when a therapist can be a great addition to your care team. My advice, don't let that stress build up. If not for your mind, do it for your heart. Up till now, Angela and I have taken a thorough look at prevention, but it's time to shift our focus. What if you've already experienced a cardiac event? Now what? Before we get there, though, I want to talk about symptoms and how you can recognize when something might be wrong. We've talked a little bit about silent conditions like blood pressure. Sometimes you don't know. So, how do you help people recognize when something is wrong?
I think a lot of the time it's those numbers, but sometimes your numbers are normal as well. So then it comes down to what's changed. And that is why I love exercise so much, because you can be really consistent with it. So you know that your 3-mile walk around the block with your dog every single afternoon feels okay. You never get breathless. You never get fatigued. You never get leg pain, and you know you're okay. And suddenly one day you think, actually, I can't do that. I got halfway around and I felt exhausted, or I felt dizzy, or I had palpitations. So there's those subtle signs that when you are fit, help you out to know something's up. Now, for less fit people, that is more difficult because you say, well, when I walk around the block, also I puff and pant because I'm unfit. So that becomes trickier, and it's trying to work out what's your normal. Is it you can walk to the end of the road and you're okay, and now you no longer can do that? So anything where you're declining, anything where you're more fatigued, anything where something's subtly not right, of I take the elevator or the lift now, I don't get the stairs, I'm avoiding going out in the evenings because I'm falling asleep much earlier, anything that's different. Now, it doesn't always have to be your heart. Many other conditions that can cause those signs as well, like thyroid issues, hormones, everything goes into it, right? But I'd say if your gut feeling isn't right, go and get checked out.
I love that. I think that you do have to be really in tune with your body. What's normal for you? What's not? Are you feeling something that you haven't before? It's better to be safe.
Exactly. And that's why I love exercise, but it can feel quite scary if you haven't done it for many years.
I do see a lot of folks getting back into exercise maybe after they've had an event. So if someone has a cardiac event, a heart attack, stroke, or a heart surgery, what do you recommend for getting back into exercise? And what should we all be doing for prevention?
The first part of it is to reassure that people know that it's safe to exercise, because it can feel really scary. Everything's a bit overwhelming, not quite sure where to start. So the first reassurance is that exercise is very safe. And we've got loads of research to say early cardiac rehab as early as week 2 after any event or surgery is really safe. Now, obviously, it needs to be tailored, and we can't jump straight back into extreme exercise for quite a long period after any event. But exercise in general is very safe. It's reassuring to show that exercise actually reduces your risk of future problems. So it's better to exercise than it is to do nothing, which is shown to have quite poor outcomes. We lose muscle, we lose confidence, we lose fitness, and that is a sort of slippery slope as we age. In terms of the prevention, that is obviously the ideal, that we prevent all these things from happening. We have in the UK, and maybe slightly different for the US, our guidelines are 150 minutes per week of moderate intensity exercise. And that means something that makes you a little bit breathless. So not extreme exercise. The other thing is getting all those steps in. So that sort of day-to-day movement and activity, those snack size, a few steps here and there while you're making your breakfast and things like that can really add up as well.
I'm glad that you brought up the UK recommendations, because actually US is the same. It's 150 minutes of moderate activity, which is roughly 30 minutes most days, and or 75 minutes of vigorous. So it could be a mixture of both. And then we also say 2 sessions per week of strength training utilizing the large muscle groups of the body.
Absolutely. Strength training is super key. Also very safe after a heart event. It can feel very scary. Often we're told to avoid heavy lifting in the brochure after a heart attack, which is very true. We don't want to go straight back into bodybuilding or really straining the muscles, because that can increase your blood pressure. But strength training in itself at a moderate level is very good for your bones, very good for your muscles, prevents falls, helps you lift up the grandkids, and keeps us strong and fit for life.
I like that a lot. And fitness trackers, I have a Fitbit that I wear. They're so awesome. I love to set goals around them, because sometimes people are really down on themselves. Like, oh my gosh, I only get 1,000 or 2,000 steps a day. I'm like, great, let's start there. And then we can set goals around, let's see if we can get to 2,500 and we work up from there. I think some folks are like, well, I can't get 10,000, so I'm going to give up. But actually, these tracking tools are very powerful for starting where you're at and setting goals around them.
Yeah, I have a lot of interesting chats about them. Some are meaner than others. I don't know how Fitbit is, but Apple's very like a cheerleader approach. You stood up for 30 seconds, well done. Whereas Garmin is very mean and says, you've done nothing today. So I think having some data is helpful because it reminds you, actually, you've done quite a lot, but not getting too paranoid. If you're a truck driver and you literally can't get up every hour, right? So it's saying, right, well, when I can have my breaks, we know things like doing 10 squats is the equivalent of doing a 10-minute walk. So trying to fit in little bite-sized pieces of activity is really helpful as well, so it doesn't overwhelm people.
If you want a cheerleader, you know what tracker to get. If you want someone to be really hard on you, then you can get a different type of tracker. It depends on the personality.
Yeah, I like mine. It tells me I'm doing good.
Positive reinforcement. I love that
exactly.
too. Well, we could talk a little bit also about my passion here, which is nutrition. Let's say somebody is very motivated because they're out of the hospital, they've had surgery, they've had a heart attack or a stroke. How do you educate on nutrition after someone's had a cardiac event?
I like to take away, again, the overwhelm, similar to what you do, where it's saying, well, what are you eating already? And what do you like to eat? And can we add to that rather than take away immediately? Because we think of diet as this big, scary sort of Monday morning, get rid of the biscuits, get rid of the cake. So we don't need to be that strict because it has to last forever. We want you to eat healthy food forever. We want you to have a few treats. So it's finding out where are people at now? What are their beliefs? What are they allowed to have in terms of if their doctor's given them some guidance or their dietitian from the hospital? And then just adding to that and saying, great, you're doing really well on your oily fish. So we don't need to add more to that. Let's focus on perhaps swapping out some of those snacks for a healthier version of nuts and a piece of fruit rather than crackers and things like that.
There's so many different things that we can focus on for heart health and nutrition. For some people, it might be the amount of calories they're eating. For some people, it is saturated fat, or like you mentioned with oily fish, anti-inflammatory omega-3s. It could be you need more fiber. So sometimes I think people are trying to do all of those things at once. They don't know where to focus. But what I like to do is exactly what you're saying. Okay, your LDL cholesterol needs attention. I'm going to probably focus on saturated fat and fiber, for example. So narrowing the focus in a personalized way can be really powerful.
Yeah, absolutely. And a lot of the foods overlap to get the end goal in a similar way. So, for example, oats, great for fiber, great for those complex carbs. You tend to then add some berries to it to make them a little tastier. So you're getting some antioxidants. So a lot of the foods overlap in terms of low saturated fat, low sodium, healthy fibers, healthy nutrients. So we don't always have to overwhelm them by going, oh, I'm not doing enough. You're saying, actually, you're doing really well. You just didn't know you were because you didn't know you were actually having oats, which covered 3 or 4 of those tick boxes already.
It's a great point. And when you eat that way with these whole high fiber foods, you're often eating low sodium, low added sugar. Sometimes I love to just go on an exploration. Like I have a client who's working on cholesterol, and I just said, let's figure out where saturated fat is coming from in your diet. And she just started reading some labels, and she discovered a lot of her saturated fat was coming from the chocolate she was eating after dinner. And we just didn't realize that. I didn't catch it either at first. And she was like, oh, I'll just have less, or I'll have it every other day. It was such an easy swap, and she just simply didn't know before she started reading the labels.
Yeah, absolutely. And we get caught out with low fat products, which are then high in sugar. So again, it goes back to that. If we're eating mostly whole foods with the occasional treat, we'll probably stay well within our limit of the things that we're told you must do this for your heart now. So to try and not get overwhelmed, we're still thinking about that Mediterranean, the whole foods, the fruit and veg, the nuts and seeds, the olive oil, those swaps for when you're at the supermarket saying, actually, I'll pick those berries instead of biscuits is an easy one. I mean, some of it will depend on budget. A lot of these foods can get expensive as well. So it's making sure that people are choosing things that are within their budget. Oats are very cheap. Some of those fancy cereals, which claim to have high protein, are very expensive. So it's saying, actually, this one is going to serve you just as good.
because you can add protein to your whole oats by doing nuts and seeds, which are also heart healthy. And you're so right. We need to think about food costs right now. It is a big deal worldwide. Berries are very expensive. And so I often recommend doing frozen berries, especially if you can get them on sale. They last longer. You can get a much lower price, especially out of season. So that's an important part of the conversation too. My last question is, if you could say one thing to someone listening today, maybe they're trying to get ahead of a heart health issue or they're on the other side of a cardiac event, what's your major takeaway that you want people to hear?
Oh, that's so unfair. I can't pick one. It doesn't count as one, but know your numbers. It encompasses the blood pressure, the glucose, the cholesterol, and your weight. And we are getting better and better at treating heart disease. So we used to not be as quick at identifying it, not as quick as treating it. So people would be at really high risk and die much younger. Like in their 50s, they would die of a heart attack, which is really scary. But we are better. That's the good news for people. We're better at preventing it through medication, awareness, glucose control, all of those things. So the reassuring thing is if you have had a family history, doesn't always mean it's going to happen to you. It's just that awareness of, okay, maybe I'm more prone to this type of thing. I need to think about it more. So know your numbers, know how you're doing. And if there is something, take action.
Knowledge really is power. Sometimes folks maybe don't want to get testing of their labs because they're afraid of what if the numbers aren't good. But honestly, the trends and the information help us so much know where to target. It can be really empowering.
Yeah, absolutely. The other thing that we didn't touch on is the menopause, perimenopause. We're getting so much better at identifying that, treating women, offering HRT if that is an option, because we know estrogen is really heart protective. So the earlier, if needed, to take things like estrogen replacements can be actually really heart protective. So that's an important one that I didn't touch on as well.
I'm glad you brought that up on the podcast. We talk a lot about women's health. We talk about perimenopause and menopause. And I think a lot of people don't realize that cardiac events and risk go up as you go through menopause.
Yeah, absolutely. Women have that protective mechanism until menopause. And then afterwards, we tend to almost catch up to men of heart disease. And heart disease, unfortunately, kills more women than breast cancer. But we have much more awareness about breast cancer, which of course we still should. But we also need to think about our heart as well, because it is just as important.
I'm so glad I had this conversation with Angela today. Heart health really needs its moment in the spotlight, and I'm happy to give it some much needed attention. To close out, I want you to hold on to the hopeful notes from this episode. Heart disease is not something to take lightly, but it's also more preventable and treatable than ever before. The tools to support your heart are truly right at your fingertips. If you take anything away from this conversation, it's that knowledge is power and being proactive prevents future issues. Thank you so much for listening to another episode of the Good Clean Nutrition Podcast. And thank you for supporting the show. I've been noticing some new faces, or ears rather, tuning in lately. So if you just found us, welcome. From the bottom of my heart, I'm so glad you're here. Feel free to drop a follow and leave a comment letting us know what you want us to chat about next. I'll see you next time.